As you said, Merck for Mothers is our $500 million 10-year commitment to reducing maternal mortality and helping the world to create a place where no woman has to die whilst giving life. And we chose maternal mortality because, quite frankly, it's unacceptable that in this day and age, 800 women die a day of something that is actually completely preventable. And we also believe that this kind of commitment is not a charity or a gift, it's an investment. And there's nothing better to invest than in women. And I'll give you an example of that. So maternal deaths, the cumulative cost of maternal deaths actually is $15 billion to the world economy. So we believe healthy women, healthy families, healthy communities, and healthy nations, both physically and economically. So it made real sense for a company that wants to be a global healthcare company, and our mission is be well, to invest in women, and we felt that maternal healthcare was the best investment. So Merck for Mothers is taking a holistic approach. We did an extensive stakeholder consultation. Merck doesn't actually have a maternal health portfolio, so we wanted to hear from the experts what we should do. We're very much focused on sustainable solutions and making a unique contribution. And the community said Merck should do what it does best, and we innovate to improve health. So we're doing things in 3 pillars. We have innovation, access, and advocacy. Under innovation, we're really leveraging all of Merck's scientific and business expertise, people's, products, processes, to actually advance life-saving innovations to get to the women that need them most. Under the access pillar, we're focused on affordable, high-quality care. And again, we were told that private providers are somewhat in the blind spot of both the global community and actually the local government as well. And yet in countries like sub-Saharan Africa and South Asia, between 50 to 80% of households go to the private sector for healthcare. So we're really looking at how do we improve the private sector's ability to deliver affordable, high-quality care. And the third is advocacy. We don't expect to do this alone. We can't do it alone. It's a huge system issue. And so we're advocating to increase awareness of maternal health, actually galvanize the private sector. We want more companies to join us, as well as driving effective decision-making and policy-making. So that's a difficult question because maternal health, as I said, is a system issue. There's no silver bullet, but I can tell you what are the characteristics of a promising innovation. I think it needs to be simple, it needs to be easy to use, user-oriented, whether that's the woman or the lowest level healthcare worker. We need to have a soup to nut strategy. When pharma thinks about a drug, they think about the person who's going to use it, creating demand, ensuring the right policies are in place right at the beginning of idea generation. And that's what we need to do for innovations in maternal health if they're really going to make an impact. If you'd asked me that 5 to 10 years ago, I think I would have used a quote, that mothers are not dying because of diseases we can't treat. They're dying because societies have yet to make the decision that their lives are worth saving. However, in the last 5 to 10 years, advocacy has done an incredible job. There are more players at the table than ever before. What we need now is effective collaboration to really advance maternal health towards MDG5. And that's going to require a commitment, clear communication, and a huge concerted effort to ensure we leverage the skills of what I call the golden triangle. So public sector, private sector, and civil society. So I'm sad to say that I'm going to have to say no. By 2015, we're not going to have solved all the issues. The global community has made huge strides in maternal mortality, and that's an important message to take away. We've reduced maternal mortality by 50% since 1990. However, there's much more to do. But what I do think is good about 2015 is it's going to enable all of us to take stock, learn, evaluate, and decide where together we're going to go to really achieve the goal. And so that's why Merck for Mothers decided to make this a 10-year commitment. We're going as fast as we can, catalyzing advancement till 2015, and then we're going to be there beyond to ensure that we meet the goal.